Hello and welcome to another episode of Doctor Simone Says. My name is Simone Eastman Yuan. I am a medical doctor with sickle cell disorder, and I am also the best-selling author of the book A Doctor in a Patient's Body, Dreaming Big with Sickle Cell Disease and Chronic Pain. But these days, I like to spend my time making sure that every sickle cell survivor becomes a sickle cell thriver because it matters that we live well. Today, I am going to be talking about medical cannabis and its use for chronic pain. I know that this is one of the topics that came up in my bedtime stories with Dr. Simone group on Facebook, and people wanted some feedback on what my thoughts were about medical cannabis and what's out there, like how do you get it, what is it safe, all of those things. And so I wanted to kind of take some time, pull together some resources, talk to some patients that are on medical cannabis, and so that when I came back to you guys, I had some information that you could work with. So on that note, let me start by explaining what is cannabis. So cannabis is actually an active ingredient from a plant that is called the cannabis plant. It is also known as marijuana as a recreational street drug. But it is the actual cannabis has a psychoactive component that is of big debate, but at the same time, it's mostly used right now for recreational purposes. But researchers are noticing that it actually has a lot of medicinal value to it. The main psychoactive part is called tetrahydrocannabinoid, which is THC, and that is one of, I think, over 100 different cannabinoids that is found in the plant. So what is a cannabinoid? Well, it is a compound that binds to receptors in the body that are called cannabinoid receptors. So guess what? Our body makes cannabinoids, which is very similar to what the plant is making, but on a much smaller scale. And our body uses it and processes it for different things. Now, researchers have gone and studied, where the receptors for these cannabinoids are located in an effort to find out what is the body making the cannabinoids for. So based on that, they were able to notice that these cannabinoid receptors, and they're called endocannabinoids because endocannabinoid receptors because they're in our bodies, and it's part of a whole system that's regulating your appetite, mood, pain, memory. And so throughout the body, we see these receptors, and they are activated by three groups of compounds, these receptors. So the first is the endocannabinoid that the body makes, so the natural version. And the second one is phytocannabinoids. So our cannabinoid receptors in our bodies can respond to plant cannabinoids called phytocannabinoids, and that's from the cannabis plant. And there, like I said, there are over 100 of them that they found. And then the third kind would be synthetic cannabinoids. So they they basically are made by our pharmaceutical companies. I'm sure that you probably in the course of even trying to get information on this have heard of tablets that are basically with the THC, the psychoactive substance, removed. But because there are all these different cannabinoids, they bind to the receptor and affect the body in different ways and can be used to treat a myriad of diseases, we are coming to find out. So in the body there are two main kind of cannabinoid receptors. So one is found like in the brain, in the lung, in the liver, in the kidneys, and then the other is found like in the immune system and in the bone marrow. And recent studies are actually showing that there may be more receptors than that. So they found some that they preliminary studies are showing that there might be receptors in the endothelium of our vessels, which would be really great for sickle cell disease, and also in the central nervous system. So these are the main places that they tend to intercept. Now, I'm sure you've also heard of cannabidiol, and cannabidiol is one of the many different types of cannabinoids. It's another cannabinoid, but it's a major constituent of the cannabis plant. In fact, I think it says it's over like 40% of the plant's extract, and they can be used for a myriad of things. Like I said, they can be used for your cognition, for movement disorders, for pain, for anxiety. So there are many different uses that are coming to light that is causing us to want to figure out what the implications of those are, and can we use them in sickle cell disease. So I wanted to talk with someone. But first of all, let me just say, with the cannabidiol, the CBD, I know that you guys have heard about CBD preparations are usually the oil, and but different preparations of CBD, that's without the active ingredient of THC. But many people have found benefit for their anxiety and pain management and things like that within sickle cell disease. In talking with patients, though, it seems like the CBD oils and things, other preparations, they are helpful mostly on the level of anxiety, and not as much for the intensity of pain that we tend to have. But it is doing one thing that I really like, and that is that it's a relaxant. So it is causing the body to relax, and that's very important. The reason why is because pain normally elicits an excitatory response from the body, and it's a stress response, and it puts the body in more stress, releasing more stress chemicals, and those stress chemicals can actually ultimately lead to heart failure because it's putting a stress on all systems. So all systems are on go. It's kind of like the fight or flight response. And I've said this before, it's the same thing as if you were to have someone undergoing surgery and not give them anesthesia. Their system would be overwhelmed by the level of pain, and they could go into heart failure. And so that is why they're given anesthesia to kind of numb the pain and keep the body in a relaxed state so that the body doesn't release those stress hormones that could then cause catastrophic outcomes. Well, the same is true for sickle cell disease. When we are triggered by pain, our bodies have that same response, and so the fact that the CBD oils and preparations can actually address that anxiety and excitatory response by causing the body to relax during a sickle cell crisis is huge. And so I would encourage you not to discount the effect that the CBD oils could have, and just to give it a try. Now, one of the things that may be difficult is to find which is the right preparation, and so that would really take talking with some of the natural medicine people to find out, because because they have the tetrahydrocannabinol removed from it, the THC, the psychoactive substance. They can be sold over the counter, and so you have all these different people that are selling the CBD oil, and it's very difficult sometimes to know what's a good product. So talk amongst yourselves, because obviously there are people who have tried certain brands and found relief, and so it's worth using it, even if it's for just the relaxation and causing the stress response to be delayed. But if you want to address pain, the levels of pain, like end stage cancer pain, which is what our sickle cell crisis pain is compared to, you will likely need a preparation that has a percentage of the tetrahydrocannabinoid, the THC, the psychoactive substance, and it seems to be that you need, depending on your level of pain, you will need a different percentage to be able to control that pain. So, in talking with patients about how it controls their pain, the thing that I was able to kind of glean from everyone is that, from for severe pain, like pain 8 out of 10 and above, it is difficult for it to address that unless you have really high levels of the THC in it, in your preparation. And what it will more likely do in the prescriptions that you would have is control the pain that ranges from about a 5 to about a 7 plus out of 10. And it can actually decrease the pain, because it has the psychoactive. For some reason, that component does decrease pain. The interval, the thing that kept coming back is that it's not for a very long time, so you kind of have to keep taking it like every 3 hours or so for it to keep that level of pain under control, but that it does control the pain. And then, of course, it's also causing relaxation, like I said, which has a powerful implication as well for us in terms of delaying that fight or flight response and that stress response that could have so much of an impact on the heart. So that was basically what I got from people in terms of, is it working, is it effective. People were thinking that it was effective between 5 and 7 out of 10. And then I asked what method did they use for administration of the medication or of the prescription. And I was told repeatedly that it is a lot easier to use the vape pen. So you can administer the preparation in many ways, right? So you can smoke it, you can vaporize it, you can use it in a food, or you can add it as an extract. So you can use it in many different ways, and smoking it is probably the least friendly way, because it's not conducive to a work environment, or where you have to be around people. So it seems like a vape pen so vaporizing it seems to be the most accessible way. And so you have easy access to the pen. You can get it with a prescription, and you can also easily put it away. It's not like you have to out your blunt, or you're eating something with the substance in it. It seems like it's a tidier way to kind of administer it, and then put it to the side, not get rid of it, but put it to the side if somebody were to walk in or something like that. So and it also you can get it with a prescription, obviously, so that helps. It the benefit of having it also in the vape pen is that the mixture is likely most consistent of the different types of administrations. So if you got an edible form, you may get different preparations, but with a vape pen you can pretty much count on, I don't want to say count on so strongly, but you're most likely to get the percentage of THC that you're supposed to be getting. So it tends to be a more consistent mixture, and easy to access, and easy to put away. So what percentage of THC the psychoactive ingredient does a patient need? Well, that depends on your level of pain, of course. That's like asking how much pain medication do you need. It depends on the amount of pain that you have. It is it is also different from recreational drugs, by the way, in the sense that you're trying to get a more consistent preparation, right? So and so that's why you're going through this route. And also with recreational drugs, you don't know what's in there. You don't know what they have actually cooked into the substance or mixed into the substance. Getting it through a prescription is likely going to be cleaner and more consistent in the percentages. Okay, so how do you ask your doctor? That's like a big question, right? I mean, who do you ask and how? And so I found out that there are a list of doctors that are available to contact, and you consult with them. And I think the website was called compassionatemedicine.com, and you can ask for a consult. And it appears to be very involved. So, I think the doctor who, in many states, THC substances are still considered illegal, right? Except for compassionate use. And so that's what you're pursuing it for. But that doctor is having to determine if you are an abuser or are you really needing it for compassionate care. So the interview is going to be quite involved because of that. They need to get your medical history, and if you can establish that you were using narcotic analgesics before, but you want to transition to use of medical cannabis. Those things are very helpful so that they can kind of flush things out and have an idea of where you're coming from. So an interview can take about 45 minutes to an hour, and likely you are being assessed, and kind of not just what you're saying, but kind of you're being assessed to see if you are a serious candidate and a legitimate candidate. And so after that point, if the doctor then says, okay, I want to work with you, then the next step is to get to become a card carrier. So you have to be legal to be able to get medical cannabis. So you apply through the state. The doctor works with you because he has to do a bunch of things, but you apply through the state for permission based on what the doctor has said for you to be a card carrier. And so from my understanding, the application is about $70, and you apply to the state for that card. Once that card comes, then you are now able to be prescribed medical cannabis. And so the doctor writes a prescription, and you're able to take that prescription to a medical cannabis dispensary, just kind of like a pharmacy. And they've had to come a long way to try to establish credibility. And so, but now, there are quite a few medical cannabis dispensaries. So you would take that prescription to the medical cannabis dispensary, and get your prescriptions like that. And your prescriptions will be pretty much like labeled and barcoded the way that your pills come from a pharmacy, right? Because there's a way they have to be able to track it. They have to be able to know how much was dispensed by this doctor and where. And so it will have all of those clarifications on it, just like you would get for your bottle for your medication. So things have come a far way, and this is basically how you would go about doing it. Now, the thing that's kind of difficult is that, again, like I said, it is not legal in most of the states. And so because of that, the research is very limited. So in terms of trying to find out, like, okay, how do I now transition the patient from, let's say, their narcotic analgesics onto medical cannabis. I mean, there might be this in between period where you might, what if they were to say stop your narcotic analgesic cold turkey and just start this medical cannabis, but then it wasn't enough percentage of THC and you weren't completely covered. And what do you do, right? Can you stay on your narcotic analgesic pain management regimen, and then slowly kind of taper off while you're increasing, your THC percentage, or streamlining it so that it could eventually manage, all of your mild to moderate pain, knowing that once it becomes severe pain, then you would have to do something else. But if you can keep it, preventively from ever getting there, then you could manage, your pain well and at home. The problem is that we're dealing with two different worlds right now, and it's one of the things that I'm addressing in a book I'm currently writing, which is, you have the world of alternative medicine, and then you have the world of conventional medicine. And so you have your hematologist or your pain management specialist likely writing your prescription in the conventional medicine world, and then you have someone prescribing medical cannabis in your alternative medicine world, and the two worlds aren't meeting. They're running parallel to each other. They are not going to cross anytime soon. And so how do you bring those worlds together so that you could have a transition from your pain medications onto your medical cannabis safely? And those are questions that we still don't have answers for, in part because we need more research, and it's limiting because the substance is still considered illegal, so then it makes it difficult to possess it, to be able to do research on it. And so it's kind of a catch-22. But people are finding, I mean, I had someone just telling me anecdotally that when he was going to school in a place that was, it had some of the harshest winters, and at the time he was choosing to use recreational THC. But during that time, he had, in the 4 years he was there, he only had one sickle cell crisis. And in retrospect, he realizes that, he was probably covered, because he was using THC, but he was using it for medicinal purposes, not realizing it. And so it was covering him for his sickle cell pain. So that says a lot, because we don't have a lot of that kind of research. But when people are actually, recalling or going out and doing it on their own, which is kind of sad that people are having to do that. But, when these worlds aren't meeting and you're the patient stuck in the middle, you kind of have to fend for yourself. And so people are, trying their best to navigate both of these worlds. And they are finding that they're getting, great relief and decreased hospitalizations and so on, from using the medical cannabis. But there is no research out there to kind of guide their medical cannabis provider and their pain management specialist to work together for their benefit. So there's still a long way to go. And hopefully one day we will see more research being done, and we will see more progress in terms of people working together to help us transition, from one type of medicine to the next. I think that I think that we will we I think that day is approaching, even in our lifetimes, and I'm certainly hoping for it at least. Until next time, this is Dr. Simone Says, and remember, you are a sickle cell thriver, not just a survivor. If you have benefited from this video any at all, please like the video, subscribe to the channel, and share the link with one other person as your good deed towards the sickle cell cause. Thank you.